Go on.
Okay, a very good evening. My name is Leon Lidigu, and this weekend we are yet back for another conversation, very fascinating and interesting conversation on data. If you watch news, if you look through the media in print and wherever, you'll discover that ever since COVID-19 took effect, there has been so much data. So today we seek to understand, do you actually understand what journalists talk about when they use certain terms, certain terminologies, when doctors use certain phrases? Do journalists themselves understand and have developed ways of just breaking it down to audiences? For example, for my grandmother in the village, So with me, I have a very interesting panel, very informed panel, and a very engaging panel. So I'll start by, since I'm a gentleman, I'll start by letting the ladies introduce themselves. They tell us a bit about themselves, and then the gents will take over, then we'll continue. So I wish to start with Madam Hope.
Hello everyone, I'm Mbori Hope Akoth. I'm an independent journalist, and I also run an online podcast radio. I'm privileged to be one of the panelists today, and I'm looking forward to a better discussion. Thank you so much and welcome.
Oh, thank you. We move on to Madam Tanushri. Is she around?
Hi everybody, I'm Tanushri Upadhyay. I'm pursuing law 4th year from Jaipur, India. It is a privilege to be the part of such learned journalists and such learned people around.
Okay, thank you very much. Where is Madam Joy? Is Madam Joy with us, Jennifer?
She is. Joyce? You have to unmute yourself.
Okay, wait, you still help? Okay.
Hello, my name is Joyce Kimani. I work for the Global Initiative Against Transnational Organized Crime. I'm based in Nakuru, Kenya, and I've been a journalist for the last 10 years, so I'm home in this conversation. Thank you.
Thank you so much. We move on to Madam Stella.
Which Stella?
Good evening, good afternoon, good morning, everyone. My name is Dr. Stella Bosire. I'm a medical doctor and a global health expert, but who also work in health and human rights and social justice. Lovely to be here and to have a conversation with you around COVID-19 and reporting.
Thank you so much. We move on to our next doctor. Where is she? Haven't seen her.
Hi.
Yes, Dr.
My name is Stella Kanja, and I'm currently working with the Kenya Medical Practitioners and Dentist Council, who are coordinating, who are part of the team that is coordinating the national COVID-19 response.
Thank you so much. You're welcome. Let us go to Mr. Eric.
Good evening, everyone. My name is Eric Ndubi. I am a journalist and editor of Kenyans.co.ke, one of the leading local websites purely operating on the digital space. Very happy to be among such a great panel to discuss such an important issue at this time in our lives. Thank you.
Thank you so much, sir. Mr. Ferdinand?
Yes, good afternoon here in Kenya. My name is Philemon Mundi. I am a BBC journalist, 14 years in the business now. Privileged from quite a lot of very interesting elections, like in South Africa, tragedies like the killings in Mombasa, and now experiencing pandemic in my lifetime. Great lessons every day. So we just share what we're learning and also learn from the very experienced panel that we have.
Thank you so much. Mr. Thomas?
Yeah, hello. Hello, nice to see you all.
Thank you.
I'm Thomas Hasel. I'm in Berlin. I'm working for Deutsche Welle, DW, for the documentary film department, the journalist since '94, and also a teacher for political science and intercultural communication.
Thank you so much, sir. Mr. Sachu?
Hi, Leon, and hello, everybody. My name is Ali Khan Sachu. I'm a financial market operative, but I've been looking at COVID since the beginning of the year and think it is the biggest event we've had in the last 50 to 100 years to hit the world. I look forward to participating in this discussion, and thank you, Leon, for inviting me.
Thank you so much, sir. Finally, Madam Jennifer.
Hi everyone, my name is Jennifer, founder and CEO of Mutwata News. Thank you all guys for joining in. I'll answer a few questions, but most of my work is the background to ensure that this thing is running properly. Thank you so much. God bless you. I hope to have a very good and fruitful conversation. Thank you.
Thank you so much. Thank you so much. First, before we understand how much, and this is for the sake of the audience, to understand what data reporting has been about with regards to COVID-19. I would like Mr. Ali Khan Sachi to kindly explain us, because he's a guru in that department. What is data, Mr. Sachi?
So when I saw that question, I thought it was a very multi-dimensional question. Just to start from this point, different countries are reporting the data around COVID-19 differently. Many countries have suppressed the amount of information that has been released. And therefore, the entire exercise, in my opinion, there has not been a single data source a journalist can go to. You've had to be synthesizing huge volumes of information from all parts of the world. You've got to be remembering that quite often what we're seeing is the tip of the iceberg. And there are so many different data points going into this equation. How many people are being tested in a country? What quality of testing is happening? We are all playing around with all kinds of different curves. People talk about flattening the curve. So I think it's as much an art as a science, simply because there is no purity around this data. There is in some countries, and we can weigh those more heavily. But therefore, I think it's a very complex task as a journalist putting all these points together, would be my first response, Leon.
You're muted, Leon, you're muted.
Yes, I was saying, as we delve in covering COVID-19 as journalists, I just want to hear it from the experts first. I'll start with you, Dr. Stella. Our other Dr. Stella, who works who's in charge at the quarantine centers. We would really love to understand from you, what is the situation in Kenya with regards to the numbers that are streaming in, the data that we are seeing. In fact, some of us will. There are a lot of conspiracy theorists I've seen online who are saying, like, there seem to be a specific pattern in which we are getting the number of positive cases. So we really appreciate if you make that clear for us.
I just want to interject for purposes of this conversation. I will be Dr. Bosire and Kanja will be Dr. Stella.
Thank you. Thank you.
Yeah, thank you, Nancy, and thank you, Leon.
Yes.
A lot has been said, and a lot of people want to project the idea that we are having some conspiracy behind the numbers that are being presented. I can say on good authority that yes, when you hear the number of positive cases, they're actually the positive cases that have been reported within the last 24 hours. We've had several limitations in terms of testing. And so previously, we were testing only those who showed symptoms. And after the mandatory quarantine period began, where we had almost 2,300 people in mandatory quarantine, they were the first to be tested. And the testing didn't begin on the first day because, again, remember this virus, after you get it, it takes a few days before you start expressing the antigens and antibodies that can be used for the testing. So it takes about 5 to 6 days before that can happen. And so the testing has been happening on the 7th day. That's when we start. And then again, another test about between day 10 and day 14. So that if someone is negative both times, then they can be released and we're sure that they didn't come with the virus to Kenya. Now, the problem has been that because, again, partly because we don't know so much about coronavirus and partly because lack of information leads to some level of stigma, and partly because we also need to protect the privacy of and confidentiality of these patients. There's only so much that we are allowed to see. So the numbers that you're given, I can assure you they are valid, they're correct, that's who we have, and that's how they come in. There's no one fixing the numbers to make a certain trend appear. No, that one is not true.
Uganda today morning, and the Ministry of Health in Uganda actually tweeted that one new COVID case confirmed, 1,120 samples tested today, 744 samples were from truck drivers at border points, 376 were from individuals at quarantine centers. New cases is from samples within confirmed standard 56. That was their breakdown. Now, Uganda, per se, with all respect, is a landlocked country and one of the 10 countries with the lowest GDP per capita in the current US dollars as of 2018 statistically in sub-Saharan Africa. It tested 1,120 COVID-19 samples, while Kenya has tested 450. Would you kindly elaborate that for me? Why? What is going on?
Okay. Testing is not just about you just show up and test. The samples have to be collected in a certain manner. To be able to collect the sample, you need to have trained personnel, and you have to have the swabs that are used for the collection and the transport media for this swab. And then after that, there's another limitation of how many tests can be run by the machine. This week, I know for sure that the testing team was actually complaining that they didn't have enough swabs, and they actually ran out of swabs yesterday. And so places that they were supposed to go and collect samples were postponed to Monday next week. So yeah, that was one of the limitations that they had.
Okay.
And on the other hand, yes, there was the issue about the truck drivers. Again, we've not gone to community testing. When you go to that point, we expect to see a lot more numbers than we are seeing, partly because it is possible to pass through the checkpoints and it's not like you're lying because your temperature hasn't gone up. you're not yet symptomatic, but you're carrying the virus. So it is possible to go through the checkpoint while carrying the virus. That's one of the limitations of the border control checkpoint.
Okay. Now, thank you very much. I'll get back to you in a while. Mr. Hassel, Mr. Thomas Hassel, I wish to understand from you, sir, as a lecturer of intercultural communication and communications generally, and also a journalist, how should we as journalists communicate numbers and reflect what doctors such as Dr. Stella are actually telling us and reporting? Are we doing a good job globally?
In the beginning of the Corona crisis, I would say the job was not very well done. I mean, I've never seen in my life that a lot of media worldwide is reporting every day on new infection cases of the disease or new death cases of a disease. So many headlines that I saw in Germany and also other countries, in the US, in England, etc., where mostly now we have this and this infection number in our country and worldwide, and this death number. And it was a very bizarre situation for me, because we never did this with malaria or with any other cause for death worldwide, that we daily check the news, how many are infected or have died of something. Yeah. So in the beginning, I think there was really, for a lot of journalists, some kind of disorientation. How shall we report about something? Many journalists, yes, have trouble in the beginning with statistics, as everyone, maybe the least scientific journalists or economic journalists, but for all others, statistics are difficult to grasp. And when it comes to a complex issue like Corona, where you have, where you don't really know how specific the sources are, how different infection rates are counted per country, how a Corona death is validated, who has died of Corona itself, or who would have died anyway but had Corona. So there were a lot of difficult to understand information behind. So now more and more I have the impression that journalists are also more and more in the loop. They ask more the right people. They expand also the information they can get. And now we talk a lot, which is quite good, I think, about the difficulty to interpret statistics and numbers like that. And now we talk about when we compare the death rate in Germany or to France, for example, or to Italy, we ask ourselves now, what could be behind these different numbers? Is that a different healthcare system, a different age structure in the country, a different way of reinterpreting numbers and counting deaths, etc. So now we have this discussion. It's getting more, it's getting on a higher level, I would say.
Now, Madam Tanushri comes from one of the biggest democracies in the world, and I'm sure India has 1.3 billion people. So I would love to understand from her, how do they compile those statistics in India? Because she's also a journalist. And just based on what Mr. Stella said, how do we communicate? Because when you look at communities, you look at the semi-literates, the upper class societies. How do we effectively communicate and make sure that grassroots actually understand, the local communities actually understand this information as journalists?
Thank you, Leon.
Yes.
I'll just like to say that India, being the largest democracy and the largest in area, and we should not forget that India is also largest in population as well. And India follows a system of three-tier data collection. That is, they collect data on various levels, that is the national level, the state level, and the district levels. So what the people around does it, they go to the district level, compile it, provide it to the state level, and then with the help of the state level, the national data is being compiled. So I agree that India has created a sound and robust statistical system, which is largely decentralized with the central coordination. Currently, the data which people on the grassroots level people can be relied upon is only the data which has been provided by the central health department, that is the health ministry report, right? Every day the health ministry conducts their conferences, video conferences, convey it to their people, because there is so much data around in the air, and it is so difficult for the people to understand, to comprehend what to believe and what not to be believed. So it is the government's duty over here to compile all the complicated, complex data, since it has been tiered in various levels. So they compile it, shrink it down, and then tell us and conveys it to the general people that what is the number today, how much we have increased, and how much things are being done, and what all things are needed to be yet done. So, yeah.
That they are compiling data in segments. Now, as an editor at one of the most read digital news platforms in Kenya, how do you break down these stories for us to make sure that the local subscribers and readers actually understand what is going on?
Thank you, Leon.
Yes.
At Kenyans.co.ke, specifically, what we focus on is the knowledge-seeking behavior of our audiences, and really try to understand what exactly are they trying to learn. So we think of knowledge-seeking behavior versus what would be an information overload. And as Kenyans, we really try to focus on what only Kenyans would be interested in. And being here, coronavirus being with us here for just about a month, we try to align the information that we publish with what the audiences are seeking. That is, at the very beginning, there was a lot of speculation about very personal information seeking from the audiences, in terms of, am I affected, am I at risk, and all that. And we started with the reports that would edge into explainers, and how to just make people understand what exactly would affect them individually. And in terms of breaking down the numbers for our local audiences, we've focused a lot on visualizations. There are several tools online to visualize data that it trickles down from Ministry of Health, Africa CDC, and MOH about tools, for example, like Google Flourish, and when you provide that information in a very simplified way, then the audiences can understand exactly what's happening. And that's also, we have done it instead of giving like a long reads, or which our Kenyan audiences really do not appreciate. We give information in tidbits, a little at a time, and we try a lot to focus, to contextualize the information to the Kenyan audiences. And as well, we have instituted a live updates page where we give probably what we'd call a by-the-minute update of what's happening in Kenya. So again, the focus is, am I affected as that single individual that we are communicating to? And that's why we try to scour the web, we make calls, we contact across the counties and MOH, and we give updates that relate to the counties, what's happening every hour. And if you go to kenyans.co.ke/coronavirus, you'll find that every hour we have at least like 5 updates, and we try to figure out what's happening in every county, not just what was mentioned before, that deaths or confirmed cases, but also what are the county governments doing And we try to even compare which counties are doing more. I think the Mombasa governor has shown himself to be an outlier, so that the focus should be on the individual information seeking behavior. Sorry, Diego, we can't hear you. You are muted.
Just 1 minute. Okay. I was asking, now as an editor, now I believe you're in the position to also highlight stories that affect those marginalized in the community right now due to COVID-19. For example, how many stories, I'm just interested to know, how many stories have you guys done so far about children? Remember on Thursday, the United Nations said that this does not affect children directly, but they could be victim in 2020, and with about 28 to 38 million of them going into being poor and suffering the consequences of poverty. So have you prioritized, created segments that focuses on children, on women, and on crime? On how are you structuring your content with regards to all this data that's flowing in?
Right. So that's a very interesting question you're asking about the figuring out the demographics angle of how people, how different segments of the population will be affected, and this was we covered it as the moment that coronavirus became apparent that it's going to come to Kenya, and there was really not as much knowledge in the online space, which really what we operate in, and we focused on, for example, the myth busting about. For example, in the beginning, there was like, oh, Africans are not affected. And then, oh, if you're young, you're not affected. And now we have come to, I think, what you're asking is now that coronavirus is here and government has been instituting several measures, partial lockdowns and all manner of things. And now we're looking at the effects on different people, especially the women, for example, as you said, being really the people who are in many ways the pillars of families and children. And so every day we, and you can see across the digital space, for example, coronavirus is probably becoming about 80% of the content published, whether deliberate or not. It is just what people are looking for, and editors in many publications across the country, are forced to have as much information available to audiences. So I think there's an opportunity to really break it down in terms of what you've just mentioned. Probably there has not been as deliberate, but for example, when we get shocking, we can call it shocking information from the daily updates from the government, when we have cases of children, and it's no longer the young do not get the disease, or they can't get severe disease, then editors are adapting to the development and now creating explainers to further the knowledge of the readers who are really searching for this information and want to be very well protect themselves. Yes.
Thank you very much. Now, let me rush to Dr. Bosire. Dr. Bosire, I'm sure you've heard Mr. Ndubi has mentioned something very interesting, that 80% of the content published right now is focusing on coronavirus. Now, from where you sit as a doctor and as a parent per se, I would really be interested to know, do you feel, in your own opinion, that the Kenyan media and media globally has done justice in prioritizing the vulnerable in our society?
Thank you, Leon, for the questions. I think even before I delve into the answers, there are a couple of things I wanted to mention about this conversation today and why it's important for us to have it.
Yes.
The stories that journalists tell about our day-to-day life, the pandemic right now and its impact are very powerful right now because one, the coverage that you have is bigger than most, even the government itself, in terms of the audience who are listening to you, who are watching you, both on electronic or on digital media. And it's very important that the accurate information be out there and be shared. I was very surprised the other day when I went to the streets and I asked, and we're doing a social experiment around COVID, and somebody told me, oh, we're told the blacks don't die of COVID-19. And this is something that was shared on WhatsApp, right? And of course, we've seen mortalities around Black people, both in the African continent and even in the rest of the world. And to have such a message getting to the public, particularly those who don't have access to accurate information, and it's wrongful information, it's very damaging. So the complexities of how it is that we look at this data and how it is that we interpret these numbers is critical for us. A very important thing also around this time, around the reporting of data, is speaking truth to power. And this is why I say that this, particularly around vulnerable populations and women, children, and the other marginalized community, is that there are certain realities of inequalities that are coming on board. Inequalities around access to healthcare, inequalities around availability, inequalities around the disproportionality that exists around access to a qualified medical practitioner, the inequalities and the realities that exist around access to even ventilatory support, or complexities in healthcare around access to ICUs. And this is not a new thing. I mean, by all means, we've known that our healthcare systems have been broken, but the realities around how it is that is translating right now is what we are witnessing. I know you're going to ask me this question, but I also wanted me to mention something very important when we're looking at numbers, and particularly around disaggregating. We are not disaggregating these numbers very carefully, right? And the disaggregation also tells a different story, because it tells us X number of children are affected. And out of the number of children who have been infected, 9X died. So for us to be able to get that, then it tells us, as a scientist, there is a way I interpret that number that is totally different. There's a way that when I say in Kenya, for instance, 4% or actually 4 to 8% of our population are diabetic. And diabetes has been shown to be one of the greatest risk factor towards severity of infection of COVID, and also ease of infection in terms of contraction. And when the population hears this, because they identify now ugonjwa wa sukari, they'll be like, oh, we need to protect. And this is somebody who doesn't even have to know about the complexities of the information or the pathogenesis. All they need to know is that we have a diabetic grandfather, we have a diabetic auntie. We need to be able to protect them. We need to keep our hygiene practices. We need to be able to continue isolating and not be in public spaces where there's risk. We need to be able to, for instance, in places where there's huge risk or there's a suspected case, wear a mask, right? Those are important information that when we say, oh, hypertensives or people with cancer are at risk, what does that really translate to the person who's watching or listening? So that's also something that we have to also to digest and be able to say how it is that we present this information. I'm going to speak about what we've seen globally is that we are hearing, oh, today 35 people tested positive, right? But what does that mean? So as a scientist, there are three ways I look at it. I look at it from a clinical perspective. I look at it from a community perspective. And finally, the other thing that is very important for me to look at it is also from a public view, right? For instance, let me pick, for example, a community perspective. When I say a truck driver, for instance, the example that you gave in Uganda, a truck driver, one of them who tested positive was from Kenya in Malaba, was positive. What does that mean? When I track this person, the fact that this person has seroconverted right now to be positive, it means that this infection occurred at least 14 days ago. So when you're doing the tracking is not the exposure now. The tracking is exposure all the way up to 21 days in some cases, by the way. And that's the data that is coming out right now. So for us to think retrospectively and say, this is not a now, this is an infection that occurred. So when you're doing your mass testing, and this now advises, or this is what influences the mass testing that we talk about, you just don't see where they have been within the last 24 hours, but where they have been, who they've been in contact with within the last 14 to 21 days. When we talk about the clinical impact or understanding of data, and even from a journalistic perspective, is to ask this question. Right now, we are talking about inequalities to access to healthcare, right? What is the doctor-patient ratio? What is the nurse to patient ratio? What is the ventilation to patient ratio right now? Yeah, those are the critical questions that we need to be able to interrogate, such that when you hear governments are saying, oh, we are having 80, like for example, in Kenya now we're in the 200s, we have 200 people. The question that we need to ask ourselves is that if all those 200 people were to get severe case of COVID, and we're lucky because our demographic dividend is very forgiving to us. We have more younger people than older people, and the risk factors in terms of chronicity of diseases are not as bad. So assuming that these 200 people are to get severe infection and they needed ICU beds, what would happen? Where we sit right now would completely exhaust all our beds. Now, those are the things that need to come out. So when you hear, oh, we are providing 1,000 ventilators, the question we need to ask, but an ICU is not just a ventilation. An ICU is staff. An ICU is drugs, essential drugs, plus the drugs right now that we are testing around COVID, hydrochloroquine, right? An ICU is even care around complications of COVID, and we've documented renal failure. Kidneys are failing right now in severe cases. Now, to be able to interrogate, if kidneys are failing, how many renal units do we have that can sustain our patients keeping alive? So that is what we have not seen globally. So we are just seeing numbers being thrown around, but what do these numbers really mean in real essence?
Over the last entire week, I've been following up stories of Kenyans who are stranded in India because they came out here for medical treatment and they got caught up in a 21-day lockdown that has now been extended until May 3rd. Now, a total lockdown around here means that we are not allowed outside. We are to stay indoors 24/7. And we're only given 3 hours a day, for example, around here to go and do shopping, groceries, and observe all the government protocols. Now, these are patients who are being treated for chemotherapy. There are patients who are having brain surgeries. There are patients who are hurting. They've depleted their resources. They're in so much pain, you know? And now the government said that ndege sio matatu. Let me translate it, that an aeroplane or a flight is not a public means of transport, a vehicle, so to speak. Now, do you think it is safe to have them come back home from a medical perspective, as a medical professional?
First, before we even talk about the safety of them coming home, that was a very insensitive statement coming from a government official, right?
Yes.
Isolated people, they've been forcefully isolated because of a pandemic that cuts across globally. Aside from that, they've depleted their resources. So we are already having a case where people need help, people need to feed, people need to pay for hotels. And when you asked about bringing these Kenyans back home, the answer that you give is that an aeroplane is not a public means of matatu. That's very insensitive, right? Aside from that, why do we have quarantine centers? Why do we have isolation centers right now? For that very purpose. That if, for example, I had a flight risk, I come from a pandemic or an endemic area, right? An endemic area like, for instance, in India, because there are recorded cases right now. There's guidelines, right? And what do the guidelines say? Quarantine these people for a certain period of time. Within that period of time, test them regularly. After testing them regularly, until you have at least 2 negative results, release them back home. And even when you release them back home, you're releasing them back home with certain instructions around care and prevention control, right? Around the communities they live in. I find this to be inhumane by all standards. One of the things that we have to remember, even as you're dealing with this pandemic, is that social determinants of health are important things that we have to remember. Right now, we have people who are going hungry. So an income inequality right now, we're already seeing. The people who don't have privileges that some of us are enjoying around still having your salary. There are people, for instance, if you look at statistically in this country, half of our population earn less than $1, and most of them are dependent on a day-to-day earnings. What is happening to these people? Who most of them also live in very populated areas, right? Informal settlement areas. Who is taking care of them? How are they accessing water? How are they accessing food? What's happening to their security, right? So those are the things that we have to be able to also talk about, even as you're talking about the pandemicity from a biological intervention, that this disease does not just need a biological intervention. This is a disease that actually needs both social and economic interventions to be able to pull out if you're to survive the economic, social, and environmental impact of what COVID-19 will show us.
Thank you so much, Dr. Mr. Ferdinand Omondi, Dr. Bosira has talked about telling truth to power. As journalists, from where you sit, are we doing enough to use the data and the numbers that we are seeing to tell truth to power?
From my perspective, I think that there is a lot of effort on the part of journalists to try and interrogate some of these facts that journalists are putting forward. As you can see, the coronavirus essentially is one of those stories that is entirely based on numbers. How many people have been infected? How is it spreading? Why are we social distancing? How far do you need to social distance? How long do you need to isolate? How long can you stay home? What is the evidence that a lockdown works? Or what is a shutdown? What is there's so many things that come into play. And for instance, like the way the doctor has elucidated, here in Kenya, there's been a lot of numbers being thrown about, and also a lot of assurances. And you have to balance between giving out what the government is giving out and interrogating what they are saying, while at the same time not contributing to the mass hysteria that is there. So in the cases of Kenya, and I see there's one of the panelists who spoke about people being obsessed with numbers here. The obsession is valid because as we're speaking about going towards the data that we get from these different countries, different governments, different scientists, that's how we know exactly, is this virus spreading and is it going down? What has South Korea done to contain the spread without lockdown? How effective was China in doing that total lockdown, which was very autocratic, but in the end of it, how did people suffer? So there's so much that needs to be digested. So as journalists, it's important to pick different aspects. For instance, if you're going to speak about the spread of it, and in Kenya here, you see, for instance, now you see the WHO has said that Africa could be the next epicenter, and that as many, I mean, there's a huge number that was thrown out that about, over 30,000 people could die, if I remember right. And when you look at these numbers, you have to wonder how is this happening. But then also when the numbers in Kenya are small, for instance, we're just about 262, or in Nigeria, the numbers are small. But remember, for instance, Nigeria, putting numbers in context is what I'm talking about. Nigeria has a population of about 200 million people. However, they've done about 6,000 tests. We have Ethiopia has a population of 100 million people, only 5,000 tests. What if they did 500,000 tests? Then what would the numbers be, and what would that in effect influence how the decisions are being made? Tanzania down here has less than 200 numbers, but this week there was a sharp rise, over 70 people who tested positive for the coronavirus. Remember that Tanzania has resisted all these measures that the neighbors have put down, the shutdowns, the lockdowns, the curfews. They're doing none of that. Only schools, learning institutions have been closed. Their roads are open, their markets are open, their pubs are open, the churches are open. So while these numbers are spreading, you have to question then, when you refuse to do this, are you then now increasing the chances of spreading going around? So, and remember, there are also restrictions that we have to work with. The Kenya government has said you can only take official data that comes from the National Emergency Response Committee, and there have been arrests from people who try to give different information. So the first thing that we do is we get official information from those institutions which are mandated to do that. And when is the Kenya government, we balance that against the standards, for instance, which are set by the WHO, which is the overall world body that gives these guidelines. So in Kenya, if there's something that is being put out that does not tally with what is general practice, then we have to put that into question. A good way in which we are trying to also manage how the government is handling this is look at human rights violations in the name of enforcing laws. You remember when the curfew, dusk to dawn curfew, was first enforced in Mombasa. Even before it was implemented, I asked myself, were policemen really given the proper instructions on how to manage this? Less than two, and I tweeted about it, less than 2 hours later, in Mombasa, people were getting tear gassed, women were getting beaten, and in Kenya, there have been at least 6 deaths as a result of police brutality. So these have been out there. And you find out that even in managing these kind of situations, even some government officials are not well informed. This is a pandemic that is the first time in the lifetime of probably 3/4 of the whole world. Actually, the first one for many of those who are alive, I doubt we were alive during the Spanish flu. So people are learning step by step. Journalists are learning step by step, but I would say that the questions have been seen worldwide. For instance, in how Italy managed their virus. Remember, the prime minister went out there and told people, well, keep on doing what you're doing, we'll manage this virus. And the leader of his political party did that, then they tested positive. And then when a lockdown was going to be enforced, news of that leaked from Normandy, and everybody escaped from northern Italy and went to the south. And the next thing we knew, Italy was now the world epicenter and had more deaths and infections than China. So at what point do you release this information to the extent that it could be part of the problem, and at what point do you try to manage it? So these are the challenges that also journalists are facing. But as far as I know, I really doubt that in countries where there's freedom of information, that journalists are not doing their job. You remember that in China, where there's huge restrictions, yesterday now, they reversed upwards the mortality. So there are more 1,300 more people, and they gave their reasons. When Italy's numbers were going up, you remember the government tried to explain that because there's too much testing and too much information going out, and that is why the numbers are spreading. And countries are learning from the mistakes. So as journalists, and what even the WHO is saying is that countries, for instance, like here in Africa, where we have countries which have less than 50 confirmed cases, do not wait to see these things happen. You have to learn from the others. And that's the data we collect from the WHO, from the Johns Hopkins University, from all these other institutions and countries that have experience and affecting these, and sharing it with the people, and government also synthesizing this information and see how they can put forward measures that will work in their different countries. Another important thing, for instance, is to look at the different context. I have seen in Kenya, there have been a lot of journalists, and maybe this is where perhaps some of our journalists have gone wrong, asking the government, why are you not enforcing a lockdown? And you have to ask yourself, and I've been impressed by the Health Minister, Mutahi Kagwe, saying that a lockdown is not really necessary at this point if people discipline themselves. And today you realize that people are not even enforcing the curfew or the travel restrictions well. Today you reveal that some people traveling from Nairobi to Western Kenya, that's Homa Bay, in a fake funeral procession. They had an empty coffin just because they needed to flout those restrictions. But then in the context of what would be an ultimate lockdown, journalists should ask, if a lockdown is enforced, how will the people in the slums get food? How will they get medical supplies? And is it even practical? In a country like the US, or let's say most of the Western countries, nearly every person is registered. There's a proper data. For instance, in Canada, so even if you're told to stay at home, there is a way money will come directly to you. How many poor people will be able to be accessed? Even the Kenya president said that now families in Nairobi, poor families, have been identified, and that they are now going to receive stipends, weekly stipends. We ask the question, how were they identified? How much will receive? And is this enough? But unlike in the US, where you see Donald Trump regularly answering questions, our president is not hardly taking questions from his releases. And the ministers also involved in these other societies are also controlling how many questions can be asked. So the journalists can only do so much. And that's why sometimes what we do, and what maybe you see me doing on Twitter, when there's something that perhaps hasn't been answered and I have that information, I blow it up, it trends, and the next day you get a reaction of the government. So this is how we're trying to use social media and the access to information and the various sources that we have to make sure that we keep the coronavirus debate going on in different angles.
One minute before I let you go. Now, from my understanding of the journalism that I know, I usually love to factor in truth in two categories: journalistic truth and government truth. So right now, in my view, we are relying on government truth. Don't you think that is dangerous, sir? Or it sets a precedent? Because our governments today are very honest about numbers, and we should just solely depend on them 100%. They're the same people who lied to us that there was no plane, for example, in Kenya, with 239 passengers that had come in. Were it not for a whistleblower, we wouldn't have known. And also, what are we as journalists doing to protect our whistleblowers who give us some of this crucial information and data?
Leon, that is a very big conundrum.
Okay, sorry, Paninel. I'll jump in because there's a question on Twitter on the similar. Someone is saying, how do we verify the data from government and from where?
Yes.
So there's that question. Are you able to respond to both of them at the same time?
Yes, Ferdinand, are you there with us?
Yes, I'm here. Sorry.
Yes.
You press the mute button. So when it comes to verification, at this point, and under these circumstances, with all these restrictions that we have, the main data that is given by the government and what they've been asking us is to trust what they give. And as it stands, and from what even the doctors are saying, because one way of looking at it is that most media houses will have insider information. Maybe from the commission itself, or maybe from the people in isolation in Baghdadi. And you may have realized that, for instance, if I give a death that occurred in the coast and somebody was buried, and well, he was buried one of the most shameful ways, and later on it turned out that he had tested positive for COVID-19. So one thing that we do is that at first you get what the government tells you, because that is the standard. Countrywide, worldwide, it is the basic information that the government gives that is the basis for the news you give. Now, once they tell you, for instance, the minister says our ICUs are sufficient, now you gotta question that. When you say ICUs are sufficient, and like the doctor explained, is it just about the ventilators? You now get the experts in that area to really challenge what this government has said. If they say that, for instance, and there's very simple information, like they say our ICUs are well equipped countrywide, you only need to go to the special care website, and you'll see that Kenya has less than, if I remember, the doctor can correct me, Kenya has less than 600 ICU beds, and more than half of them already.
250, and I'm correcting you on the spot, 250.
Oh, there you go, 250 ICU beds. Do you see that?
Yeah. Functional ICU beds, and I'm even counting private facilities. This is not even government.
Sure.
There you go. So when the government tells you that there are sufficient ICU beds, now you have to question. These are total beds. Remember, there are those who have cancer. There are those who require different operations. We have pregnant women who are having difficulty giving birth. And don't forget that, and the doctor again can tell you, in the cases where there are ICU beds with people with COVID-19, then that means that ICU beds will be used for everything else. And that is why hospitals, and I won't mention them, there are some that have been turning out suspected COVID-19 cases. So when it comes to preparedness for extreme cases, the government has been blatantly lying to Kenyans, and I think they've been called out on that. And that is what sometimes they say. Later on, they came on to say they are now increasing capacity and going and mentioning how they're doing the increasing capacity, for example, in the Jomo Kenyatta Hospital, and also increasing capacity in different level 5 hospitals. But you have to trace that and to follow that and see how many of these actually can cater for COVID-19 patients, considering that they have to be put in total isolation. So, and in this case, it is not the journalists who answer these questions, is to find the experts like the doctors here to give context. So the danger for many journalists will be to spew the numbers and later on not to find the backstory to it. So when we say, for instance, artists will receive 200 million, and that is about, or let's say $2 million, if I may now go original, every month, you have to look at how many artists will be there and how many will be able to receive that. And by you say artists, there's just musicians, there are actors, there are creative artists, a lot of whom also cannot sell their products. So how will this be distributed? And later on, some artists say that if you look down and break it down, it comes to less than $50 per artist. Will that be enough? So this is the kind of data that now we have to go back and synthesize it. If there is a disparity, and right now what we are asking in terms of the confirmed cases in Kenya, that's why you have to say, you have to give context. And I think the minister has been very forward in saying that Kenya's cases could be much higher as soon as the mass testing begins. And we are seeing that we are getting closer to 1,000 tests per day. I think today is when Kenya finally tested more than 1,000 in a day. And this was attention. So it's
yes,
very important for us to look at that in that context, that while Kenya may have 262 confirmed cases, it could very well be that Kenya already has thousands of cases, but they have not just been tested and verified. But as it is right now, when the government says confirmed cases are 262, that is what it is, because those are the ones which have been confirmed. That's the difference.
Thank you very much, Ferdinand. Now that leads me back to Dr. Stella for just a minute. Dr. Stella, I really would now to understand, because you've been running around the quarantine centers and working around the clock, doing an amazing work to save the situation. Now, I just want to understand what is going on at the quarantine centers, because many people are complaining days are being extended. Some of them are saying, oh, we cannot afford this. They simply don't trust what is happening in terms of extension periods and everything that is going on over there. Would you kindly react to this?
Okay, before I react to that, yes, in the last 24 hours, we had over 1,100 tests run, not 450 like you had mentioned earlier. Secondly, when you're looking at the number of positives today, as Dr. Bosire said, we are looking at infections that happened up to 2 weeks before or more. So given that, now the quarantine centers were set up just to host those who had arrived during the week, I think from Sunday 22nd up to Thursday 26th. Those are the ones who are held in the quarantine centers initially. What happened is that there were 2 categories of quarantine centers. Some were already set up for like self-contained rooms where there's no sharing of the room or the facilities, whereas others were like the KMTC are like in a dorm setup. You have your own room here, but you're sharing the bathrooms and the dining area. And in some of them, when the clients came in and they were advised on social distancing and basically keeping to themselves, some of them did not comply with the rules. So unfortunately, when confirmed cases were found in those centers, again, these people that they had interacted with in the center became contacts. And so even them, now they required their period to be extended. So the first time we had a few positive cases and those were removed and taken away. And the quarantine was initially extended by 7 days for some. For others, up to 2 weeks. And even after they were moved to different centers, I understand that they're still not maintaining social distancing. And they keep exposing themselves even more. So a lot of people are getting their third, they were negative for the first 2 tests, but the third test, they're already positive, meaning they picked it up within the center.
Yeah. So isn't that a risk in itself? Isn't that a risk in itself?
Yes, it is a risk, and that's why anyone.
If we are having people getting positive in quarantine centers, isn't that a risk in itself?
It's a risk, yes, but as I was saying, what we did was to remove those who were at higher risk, those who had pregnancy or any other health condition that would put them at a higher risk of getting infected. If they tested negative the second time, they were removed from the quarantine center and allowed to go home to complete their quarantine or at the end of their quarantine period.
Oh, okay.
So we try to minimize the risk by that. But we have to understand one thing. The virus is carried by us. I am the virus carrier. Yeah, you are the virus carrier. You have to be the one to protect the other people. You have to take it upon yourself, make it your personal responsibility to protect other people. You're not maintaining social distance to please the government. You're maintaining social distance to protect your loved ones. Yeah. We don't want a case of like we can literally attribute 42 cases to one person. That is not even fair to the rest of the community that's actually going to be paying for your healthcare when you're in admission through your taxes. So we need to take personal responsibility. We need to understand. It's the same thing in terms of the curfew implementation. I think that's something that may have been missed in the communication to the police, and maybe it arrived a little later. It's not just about keeping people indoors. Why are we keeping them indoors during the curfew period? To stop them from interacting with other people and spreading the virus. So we need to do these things humanely and to make people understand why you're doing it. Like, why are you required to wear a mask? Because it has been shown that the virus can spread even through just breathing and speaking. You can release virus droplets. So everyone needs to take a personal responsibility and say, I am going to protect everyone around me, and I'm going to do what it takes to protect them.
Thank you very much. Dr. Bosire, do you have anything to add?
I think one of the greatest failures or successes out of this COVID response will be based on communication. I think that's our biggest tool, as this is a disease that still has not been shown to have any treatment. We are all postulating on drugs that are functional, but what we are sure about is mode of transmission. So technically speaking, public health interventions around reducing the spread. However, even as we do this, we have to be really careful about the human rights violations that are occurring, right? Scientifically, I mean, even biologically, when you quarantine an individual or a patient, are you able to provide them with the basic amenities that they require? And this is what is actually coming out. And I'm saying this even as a frontline healthcare worker, this is something that has come out. We've seen videos, right, of quarantine centers which they're poor in terms of hygiene, which already is predisposing an individual to another disease, right? We are also seeing quarantine centers which are not even following the isolation guidelines as has been put by WHO and adopted by the Kenya Ministry of Health, right? So we are seeing people mixing. You've quarantined people for purposes of disease control, and these people are mixing during meal times. These people are mixing in corridors. People are sharing bathrooms. So the question you ask yourself, and that this is why you're hearing that there's extension of the number of days, is that an individual came in, they were supposed to be quarantined for 14 days, and then within that 14 days, they've been mixing it, they've been mingling, right? And then there's a positive case that is found, like has happened recently. So what happens to those ones who are already negative? They have to stay in for another 14 days. So it's also a failure for us from a healthcare workers. Let me own that as a medical doctor. It's a failure, because if we were to practice critical quarantine and infection control and prevention, then would not see what we are witnessing right now, en masse putting people in one institution and not being able to provide them with the right information. That even when you tell them you're quarantined for purposes of infection control, Dr. Kanja is saying very well, do they have the right information? Is this information updated regularly? Do we speak to them regularly? Do we address their fears? Are we taking care of their mental illness, mental health risk? Because that's also something that is coming out, right? There's a lot of anxiety. People are dipping into mild depression because of being in these isolation centers when they are not even being talked to. And also the issue around stigma and discrimination. And it's unfortunate that even propagators of this stigma and discrimination is the state. And as healthcare workers, we are to protect the people. We are not treating them as outcasts just because we suspect they might have been exposed to COVID. We are actually even protecting them, being able to ensure that the right care is given, and also protecting the public. So we have to be really careful when we are putting in biomedical interventions in situations where there's a very thin line around human rights violations, like already we are witnessing. And not to mention police brutality that has already been spoken about.
You've listened to, yes. Madam Hope Mbori, do we have you with us? Madam Jennifer, is Madam Hope Mbori around?
No, I think she left.
Okay.
I think Dr. Stella wants to say something.
Okay, Dr. Stella, please go on.
You have to unmute yourself.
Sorry.
Yes.
Like Dr. Bosire has just said, yes, communication was one of the things that probably didn't go very well in the response. And we own it as, yes, we had some major gaps in terms of communication. But I think in the last maybe 2 or 3 weeks, we've tried to really up our game on that. We've tried to break down messages into things that are more easily to understand for most people. I think also there's an element of rebellion. Like we have been seeing people trying to break down the lockdown, as in you've been told not to leave Nairobi, but you're finding other places to live. And then you're going to tell people that you actually beat the police curfew. If we keep on with this rebellion, trust me, this thing is going to even be worse than it already is. Thank you.
Back to Dr. Hassel. Dr. Hassel, much of what the doctors have been speaking about revolves around, especially with their complaints with people and how they take care of themselves and taking this information seriously, it revolves around communication. What are we not doing as journalists to explain to locals, to explain to, the most common people, because some of them just want to live their lives, they want to go about their day, they don't understand what actually is happening. How do we deal with that?
I think the problem that we face here is that we all have a pandemic that we've never seen before. That's at least what virologists are saying, and that's what we as journalists are also telling people. Most of journalists are not experts in virology. They have to believe what is said by the state or by the medics or by virologists. So we try to give on this information that we get from them, and then we try to give on all those measures that have to be taken to reduce the spread of the virus. But of course, we talk to people who cannot just stay at home all the time, who are socially so dependable from everyday life that it's hard to tell them, here are the measures of virologists, and we don't care for what's going on after that. I mean, the consequence of what we're doing here will be felt in the next decade at least. We have here a big economic and social crisis who's getting bigger and bigger. I mean, Germany is quite a wealthy country, but here as well, I see people who lose their jobs right now. Many people. We have a social welfare system which can carry them somehow for some time. But at one point you have to pay money back. I mean, taxpayers or anyone has to pay for these things. And if I think of a country that has not these possibilities, not this social welfare system, not the healthcare system to provide for people who get ill, I can't even imagine what would be the consequences there. And I think the difficulty for us journalists is, one, to make clear how dangerous, how serious the situation might be, but also think of all the consequences that this might have. Yeah, and this is, I think people rather would believe or trust in what also the media is telling, if the media shows that we see the problem from all kinds of perspectives. Yeah, that we are aware that for a country like Kenya, when there's no tourism for the next year or so, no income by tourism, this will have a huge impact. You have to think of that, of course, and you have to deal with that. And the more open, in my view, media, but also politicians, governments are with the failures that were done in the past by not, for example, installing a healthcare system, social welfare system that kind of works right now. The more open they are, I think the more trust they can gain right now. And what we see with this little virus that is nearly invisible, it's invisible for the eye, but you can see it with microscopes, but it's invisible to people. So it's hard to believe what it really can be. You know it when you see someone suffering of it, of course. Yeah, but we have to make the invisible, we have to explain the invisible and all dangers that can come out of that.
Before I invite Mr. Sachu, I just want to remind our audience that is viewing us that after Mr. Sachu speaks, we shall be sampling some of your questions before we proceed on. So don't you worry. And then, Mr. Sachu, what next post-corona? What will the world look like? What will the economies look like?
Okay, let me answer that, but add a couple of things in very quickly. Regarding your data points and government and information, even though China, the second biggest country in the world, corrected the numbers that they released yesterday in the case of Wuhan, those numbers from any mathematical modeling basis are complete garbage. Many more people died in China than they're telling us. Many more people were infected than they're telling us. So let me also throw back for something for everybody to think about. Why has international media and media accepted those Chinese numbers pretty much at face value? There is no mathematical system which can produce those Chinese numbers. So I'm just asking, because this was also about data integrity and so forth. The next point I just want to touch on before I get to the economy is people don't understand nonlinear multiplicative mathematics. It's very difficult for people to understand. So for a lot of people, even politicians, they kept telling us, the numbers are like the flu, relax. I call them the flu people. Because what they were looking at was looking at something which was not as multiplicative as the coronavirus. What do I mean by that? If you don't have any intervention, 100 cases jumps up to 35% per day. So you jump from 100 to a huge number very, very quickly. Frankly, we're going to discover this in Africa. Because in the early stage, our interventions, our testing have been so low, they're making absolutely no impact. And I mean utmost respect to all the professionals you've had on this show, because they've been so committed, and I'm so proud to hear what they're doing and the quality of their intervention. But the point is, we're looking into the past and think we're looking at the present. We're not. What we're looking at was weeks ago, like your doctor said, and really we've got something here. You know, I saw comments by Kalonzo Musyoka, we're black or something, it's not going to hurt us. Nonsense. It's hurting colored people much harder in the Western world, and it's going to explode here. So those are the points. In terms of the economy, and the previous guest made a very, very good point. Look, from an economic perspective, this is apocalyptic for Africa. Why? Let me explain. Our governments were reckless in the amount of money they borrowed. The virus has told us that the money they spent was a waste of money. We have a $4 billion railway that's ending at Mai, right? We have other infrastructure projects which no one is going to use right now. And what do we have happening in our economy? Remittances. One of the biggest source of income into Africa is Africans abroad working and sending money back. They're all coming back home. Remittances have collapsed by 80%. Tourism, and of course, Kenya is one example, but there are others which are even more dependent, Seychelles, the small islands, etc. Tourism is done. There is no tourism because we've entered a world of quarantine. We belonged in a world which was hyper-connected. We're now in quarantine. And whoever's telling you, and we'll probably have to experiment with opening up or keeping our economies open, but it's one cough and this thing is going to start like wildfire again. So the way I see the global economy, it's in quarantine, whether Trump likes it or not, whether whoever likes it or not, it's in quarantine for the next 12 months. Airlines are bust. There is no way, unless you're going to pump in billions of dollars. Fly South Africa just closed down, 4,700 workers sent home. So what you're watching is a once-in-a-century pathogen, which is a once-in-a-century economic hit, which is going to hit Africa hard. And that is the question, how are we going to deal with it? And I think maybe places like South Sudan are the places we should look at, because they've been dealing with it now for 10, 15 years. Go back to the land, make sure we're producing enough food for our people, and do the simple things, because that's what it's going to boil down to, in my opinion. And I think the economic hit, look, IMF came out this week, World Bank have come out this week. We're talking about negative rates of growth in the region of -5 to -8%. This is unprecedented, and really it's an unprecedented scenario.
Mr. Sachu, I would love you to respond to this. Now, Trump cut funding to WHO. The politics around it, the geopolitical impact around it. Where are we headed to? The China wars, the blame shift, the blame games. Kindly react to that.
So let's look at WHO, but let me say this about Donald Trump. Donald Trump believed he was a reality TV star who did not understand the science behind a virus, did not understand the multiplicative risk, was warned in November by his intelligence services, and did nothing through the whole month of February about getting on top of the situation. Compare him to Merkel in Germany. Merkel is a scientist, she's not a populist, and she dealt with it more scientifically, and you can see the results of it. Now, when we look at WHO, the geopolitics of WHO, I'm not, let's look at it separate. WHO was spouting whatever the Chinese Communist told them, right? They told people you could travel when they should have shut it down. They exported this virus to the rest of the world. I think Dr. Tedros is outrageous. I think it's just, when I heard him saying that, picking on me because I'm black, I thought, my God. And I'm saying that as a colored person. I was shocked. I think that one day Dr. Tedros will have to answer to the International Criminal Court because he has aided and abetted the export of this virus. They only got to Wuhan in February. What were they telling us all through those days? They said there was no person-to-person transmission. They said travel all around the world quite happily. They reversed these decisions, but the key interventions they should have made in January and during those key weeks, they never made. So it's quite a complex issue. And I think in the WHO's case, they have not been independent of China. They have not interrogated the Chinese data, and they just repeated whatever the Chinese Communist Party asked them to repeat. Therefore, and then on top of that, when you talk about information, they've been calling it an infodemic or something and censoring anything other that they disagreed with. So in fact, international media has been censoring any comment which is not agreed with the Chinese Communist Party.
Okay, Dr. Bosire, I know you wish to respond to Mr. Sachu. The floor is yours.
I wish to respond to Mr. Sachu. I agree with 80% of what he says, and I disagree with 20%, and here is the reason why. First, this is the time of not playing politics. Let's start from there. We are in a global crisis. It's a matter of life and death. So while I agree there are questions that need to be answered, I also want us to be very careful around the proclamations that we make where life and death is concerned, where lives of people globally are concerned. Second thing, we also have to recognize that while WHO is a member state, 192 member states who are signatories or who agree or who develop, and who, for instance, we are represented by our ministers of health in WHO. So WHO, it depends upon the countries to be able to give them data, right? So when there are errors that are coming in, you don't go into other people's jurisdictions and start telling them we need to be able to go down their end, even when we have country representatives, and we do in WHO. The third thing is around honesty. So while there's a question around the responsibility of WHO as a member state organization, and if you're taking the WHO to court, you're taking literally 192 member states to court, ICC and everything, and the leadership. The question that we need to ask ourselves is the authenticity of the data that the China give. If you're noticing recently, they're giving different numbers in terms of the case fatality rate has gone up. It's like, oh, we underreported. The fourth thing I want to say also is, this is a novel virus. to be very honest. I am learning a lot of things as you are learning a lot of things. Even those who are experts, infectious disease experts, are learning new things. I mean, you should see the material that is being churned out every single day around coronavirus 19. It's new. That is not to excuse the errors that have been caused, that have costed people lives, but that is also to also question the place of pandemicity report from response and preparedness globally. So by the time we were discovering that this virus is transmitted through the respiratory droplets, we also are discovering this virus is also, there's some transmission through the fecal, modes. But we are also finding out that this virus can stay on surfaces, in some surfaces, up to 72 hours. So we are not just dealing with a virus that is a danger to the human, but we're also dealing on a virus that is mutating in a certain way that we need to understand it better. So with all due respect, Mr. Sachu, I would be very careful around politicizing a matter of health right now, and say that while there's issues of accountability that have to be responded to, this is not the time. This is the time to ask questions that we are asking around ventilation, around ICU support, around economic cushioning, around supporting our communities. This is the time that we have to not just problematize, but find solutions. And here I'm not absolving Tedros. I'm not. I also have critical questions, because this is the first time in my career I feel at risk going into a health facility. It's the first time I feel like I am going to offer care because of my technical expertise, but I'm also at risk of coming back and not coming back to my family, either dying or being isolated from my family. But with all those emotions, I am also cognizant of the fact that I cannot dwell on that, but I need to dwell on the solutions.
Interesting. I believe also that political climates affect all climates. Anyway, besides the point, Mr. Ndubi, are you around? Mr. Ndubi, are you around? Mr. Eric Ndubi?
Yes, I'm here.
Yes, sir. Now, I wish you to react to this. There's a question for you here on a forum that someone is asking, as an editor, how are you taking care of your journalists to ensure that they don't burn out?
They don't what? Please.
Burn out. Now that everyone is working round the clock, what measures are you putting in place? Do you have masks for them?
So what we did very early at Kenyans.co.ke was to have, we had the advantage of being able to work from home much more than our broadcasting colleagues. And I think at the point that we were 2 weeks or 1.5 weeks into Corona being real in Kenya, because at some point people would not, while we were ranked as one of the most at-risk countries or cities in the country, at about 1.5, 6 weeks, we made the decision to work from home, and we gave very specific instructions to our journalists to only work from home. And we have, with our admin department, we have our admin on call at any moment for any of our journalists who, for whatever reason, has to work from the office. And one of our few journalists who work in the field, like attending the pressers and following a story that needs to either to go to a quarantine center when we get information that is something. And the quarantine centers have been one of the places that we have been having a lot of unstructured approach from the government, and we needed to be physically there to confirm the claims that come from people who are really facing a lot of difficulties. We have given them the necessary precautions to observe, and we have a dedicated staff member working with our journalists on the field to ensure they have the mask, they have the transportation required, they don't use public transport.
Okay.
And yes, so I think even many other media houses locally have, for example, I think notably Citizen TV, they have really upped the protection of journalists to ensure that they are not really at risk So I think I would commend the media or companies in Kenya for ensuring that their staff, when they really need to provide information to the public, that they are very safe and there's staff on call every time of the day to ensure that journalists who would be at risk are protected.
Oh, thank you very much. That was a question from one of the members of the public. Now, let me go back to Madam Joy. Madam Joy, are you there? Before we field a question to Mr. Sachu as well. Madam Joy, are you there?
Yes, I'm here. Let me switch on my camera.
Okay. Madam Joy, at the at GTalk where you work, are you guys monitoring the numbers and the data that is coming from girls who are being abused? There's some stories of girls who are being abused now that kids are at home, that's idle, or perhaps they have a lot of free time. Parents are busy doing other things also. So have you guys been following up on the safety, the safety data that has been coming out with regards to children, boys and girls and all people of gender and all that?
It's been very interesting.
Yes.
It's been very interesting following up on the crime that comes as a result of the current situation that we are in. And one of the things that we've noticed, especially around children, is there's a lot of domestic violence from the men and the women, from the parents, and it translates both to the kids who are on the ground. So one of the things that we've been looking at is the crime patterns have they increased. I think one of the most interesting and sad thing for me has been there's a lot of sexual abuse that has been on the rise for kids, especially for young girls. Most of the girls find themselves entrapped because you can't go out, you can't go in, and so you're stuck with abusers. And we've seen a lot of repeated abusers, which poses a challenge to the gender desk in the police departments, in the NGOs. Are they reaching out to kids who are out, who are maybe quarantined in the house, which for me has been a major concern. I think our kids are emotionally bankrupt at this time. We see kids who are just screaming around, kids whose lives were interrupted. And I feel like they've not been given even sufficient information. They just woke up one day and they were told, you can't go to school tomorrow, there's corona. So they don't even understand what this disease is, but we also, I think for me, the other major concern is they found themselves trapped. They found themselves trapped in a situation which they are not aware. We've been monitoring the sexual abuse and the emotional abuse. And I think one of the things that also as GTalk we've been looking at is the cyberbullying that has come about, especially for young kids. There's a lot of release, there's a lot of intimidation, there's a lot of abuse on social media. Let me point out Telegram because that is one of the worst that I've seen. We've seen kids whose nudes are being leaked on social media, and adults are the ones who go downloading such things, which is embarrassing for me. But we've not cautioned our kids, especially with the crime that comes as a result of this whole virus. So kids are just left out hanging. Kids are just left out, maybe abused or insulted, or they don't even know what exactly is going on. And I partly blame the media for this. We've focused so much on corona in adults. We focused so much on what is the drama that is going on, and we've left the young generation per se. We've left them out. There are no, for example, basics. There are no posters that tell kids this is how to protect yourself during the. This is how to protect yourself during the coronavirus. There are no like booklets. There are no, in fact, no even video WhatsApp messages. I haven't come across any. Maybe they are there, but I haven't come across any where a young kid is talking to the other kids. So at the end of this, I think at the end of this, one of the things that will be most interesting for me is to follow up on either what emotional effect did the corona have on kids? I think I should also point out that it's been interesting. I was talking to a children officer today who told me that a lot of kids have been attempting suicide as a result of being stuck in the house, intimidated, maybe with parents who don't get along so well. And so the man was telling me that a lot of kids have been attempting suicide, which is a concern for me. I feel like we should open the gaps. We should also try to get kids to maybe interact, to share their opinion about the coronavirus. Another thing maybe that has been a concern to me has been how, don't get me wrong, I like the way kids read. Kids go to school, but I've seen teachers and parents forcing their kids to read during the coronavirus period. And I feel like, in my own opinion, this is unfair because even as an adult, I cannot be able to be stable and work normally. I cannot read, I cannot schedule. But I have a 7-year-old niece who has 1,000,001 assignments, and it's eating her up just the way that she doesn't understand whatever is going on about corona, and then she has to deal with books. So I feel like we are neglecting the kids both emotionally, physically, and the complaints on Facebook have been kids are eating too much. Which is also, maybe if I'm a kid and I see that my parents posting something like that, it will eventually affect me. But we're working on eggshells. We're looking at a lot of, I'm predicting, and I've seen it in different countries in East Africa where there's a lot of domestic abuse, there's a lot of sexual abuse among kids, and there's a lot of, it hasn't, like, we haven't confirmed, but there's been also cases of teens who come out and say that I've been raped by a relative, or I've been insulted by a relative, or being beaten up. And I've seen several cases of kids who maybe they just want to give up, and either they want to commit suicide or they want to just end it all. So I think that's an area that most people have really ignored, that it's something that should be looked into. I also want to point out, maybe as a by the way, we have a lot of deaf kids in Kenya. Particularly, let me point out in Nakuru, because I've worked with them before. And just like the adults, the deaf kids have also been left out. They do not understand Corona well. And so what has happened is there's this communication barrier among deaf kids. I was talking to someone who is deaf who told me that just the other day, a deaf kid was found outside, and the police, this is Nakuru, the police beat up the parents who unfortunately also deaf. They were also beaten up just because their kids were found outside. But you see, even the way we communicated to the kids that you're not supposed to be outside during the coronavirus period was wrong. I remember my niece, she's 6, she just called me one day and told me, "Auntie, don't get out of the house because the police are beating up people, they're beating up parents of kids who are found outside the house," which is a ridiculous, extremely ridiculous notion. But it's happening. The parents are being beaten. So unfortunately, the deaf kids fell victim of this, and their parents are punished because the kids are
now
outside.
Madam Joy, any reports to that effect or with data? Because many people are asking, they will be interested to see reports and data from your organization, at least so that we know on these issues.
So what happens now is because it's, you see, it's a novel that is every day it's something happening. So we've done reports, we've done research, but on a global level. Like we haven't been able to focus mainly on the kids. We are working on that. I know there's a document on the pipeline. We publish the risk bulletin every end month. So I know we are focusing on that. We have people on the ground who are looking into, such data. And maybe probably by the end of May, we'll have like a documented report towards that.
Now, in your view as a journalist also and a person focusing on transnational crime, are the stories being done out there to highlight the plight of kids during COVID-19 enough? Are journalists doing enough? Are they giving kids priorities? Because there are many issues with regards to education. Many kids don't know when I'm seeing questions here based on how, or when will schools finish, what will be the curriculum, with some will be promoted like that. So what from the many people you've talked to out there in your line of work, what have you gathered so far in terms of journalists covering and prioritizing children during this coronavirus crisis?
Unfortunately, we've shelved the kids again. The kids are an invisible team. The only time the kids were mentioned in Kenya when it came to reporting on corona is when was this 6-year-old kid who had the corona who passed away. I think that's the only time I felt like now kids are being told, like, kids cannot get to corona. That is the only time it was raised. And I think the time a kid crossed to Tanzania, not to Uganda, a 2-year-old kid who crossed to Uganda, and maybe the kid who was killed as a result of the curfew. So our reporting has, sincerely, I feel like journalists have failed children. I know I have a soft spot for children, but journalists have deliberately ignored maybe reporting even positives. I saw a positive story about a kid who is a baker and is utilizing this time to bake cakes. But I feel like kids are also sidelined as usual. People are not looking at either positive or negative stories well in regards to the kids. So I think there's room for improvement. I'm so sure there's something done for the kids, especially because we have a lot of publications that focus on kids only. I think we have Young Nation, we have the Standard has a publication, and internationally, but even the coverage for kids has been horrible.
Thank you. Can
I jump in? Can I jump in, Leon? Leon, can I jump in?
Go ahead.
But we can't hear you properly. But anyway, I just want to add on what Joyce is saying. Important is we basically report on children, and what we have seen is, apart from that one case of a child, when that child died, we have not seen significant reportage of children. And right now, as you said, the children are not the face of this pandemic, but they are the victims. Not they are going to be, they are the victims. They're the ones who are losing education. Like UNESCO is reporting 1.6 billion children are out of school. In Kenya, I was reading a report today, it's 1.5 million children who are out of school. What does that mean? That means that we are losing a huge generation. And that's just school. We talk about child protection, children who are being abused at home. The CJ that they talked about the increase in the number of abuse cases at home. But I'll just talk like what Dr. Bosira says, but is anybody doing this, talking how many child protection units are available? If a child wants to go report, how many child protection units are available? If, like, for example, has anybody done a report on children in institutions? You know, that we have quite a number of institutions in the country, both run by government and those not run by government. Has anybody said, what are these children eating? How many are they? Do they have homes? And because now there's all this decongesting thing that is going on, where are they going to go? You know, are there rescue centers at the community, at the county levels? Now counties and are rushing to have, they are rushing to have what they're called ICUs, but are they actually establishing child protection units? Or for GBV units, are they establishing those units? So we need to start seeing journalists going beyond the medical data to other social data. And I'm sure Alikan will come later to talk about the business data, but we want to see data that's beyond the medical data, that when you're talking about COVID-19 is not only a medical issue, it's an economical issue, it's a social issue. So the holistic view of COVID-19 in terms of how it's impacting the current generation and it's going to impact our world. Thank you so much, Leon.
Mr. Sachu, much of the questions I'm getting around here, looking at the Instagram and other social media feeds, they are going around on the ease of doing business post-corona, the economic impact that corona is going to have going forward. What should we expect and how should we navigate? Kindly.
So thank you, Leon. I think, we can see very clearly which sectors are going to take a hit. I mean, as I was telling you, we are moving from this world of hyper-connectedness to a world of quarantine. I imagine the quarantine or semi-quarantine effects are going to be here and through the end of the year at the very least. So I think if you're in tourism, you've got to look very, very hard at how you try and reinvent yourself as best you can. I mean, I saw, for example, a lot of live feeds, people in game parks, no visitors, but now they're, giving us live feeds and you can plug in and see what these guys are seeing. And I think you've got to try and be more digital and try whatever you can. But let's not sugarcoat it. It's very, very tough. If people don't have income, they're not going to be spending on extraneous things, right? So just think about that. Your online businesses are going to do tremendously well. You're seeing that in the stock market already. Netflix has gone up, subscriptions have gone up, supermarkets, one imagines. So there are going to be some winners, but there are also going to be a lot of losers. And I think really, if I was advising people, I'd say keep some cash on hand if you can. Try and keep some money in the bank. I was speaking to somebody who, funnily enough, is one of the media owners, and he says, Ali Khan, we had a business, we was already doing well, we were just surviving every month, but the corona has allowed me to make tough decisions I wouldn't have made before. And I think he had a point, Leon, as well. So, when the going gets tough, the tough get going, as that old song said. I think you've got to be tough right now. I can't pretend it's going to be easy. I clearly see there's some businesses that are going to be winners and some are going to be losers. And I think a lot of it's going to be about online experiences. And I think that's where one has to look at now. If you believed in the digital world, this is the tipping point towards that world.
Thank you, Mr. Sacho. Madam Tanushri, are you with us? There's a question here for you. Someone would like to know, what is the experience of a lockdown? Is it working in India? Are you seeing the fruits of a lockdown compared to other places where people are actually anticipating lockdowns?
It is indeed very difficult to be in such a situation of lockdown currently. It is not easy at all to be locked up. We had such a life full of hassle. But this was the need of the hour, I guess. Though the government is trying their level best to provide us with all the necessary commodities. The shops are opening up. The medicals are there. All the saviors. There are corona warriors for us, struggling day and night, trying to help us their level best, and we are trying to adapt ourselves. This, I guess, we need to accept it because this is the need of the hour, and we cannot complain at all, right? Because if we'll be complaining like that, then it would be no use. If it is the people of the whole country who need to come up together to accept the fact that okay, we did not volunteer to be the part of this thing, but now we can volunteer and help this out and stay in, work together, stay safe inside, locked up, so that the government can actually take up some things, can ease up, can work properly with the help of this lockdown.
Another question for you also, that how is India actually feeding 1.3 billion people, especially the low income households?
See, Leon, it is not an easy task to feed such a large population, but the government over here and the people together are voluntarily helping them out. They are setting up food, they are providing them with food facilities, they are providing them with the uh, some monetary help, although it is not sufficient, of course, but something is better than nothing. And we cannot deny the fact that India is one of the largest population, and things are not easy to be done. So the work done by the government here is considerably good. They're trying their best. Okay, I might be seen defending my government right now, but that is the reality. They are trying their level best, and so are the people over here. They have created various funds, people are donating, and that donation is being used up in some way or the other. They're trying to help, so are the people. So yeah, still the data is not very sufficient to say whether we are able to come up with a very good but we got to believe the fact that yes, something has been done, but the data is not very sufficient.
Okay, thank you very much. Now, Madam Bori, I think I've seen you around. Is Madam Bori with us? She was having some challenges with regards to her gadget.
Yes.
Jennifer, is Madam Bori with us?
Yes, she is. Hope, please unmute yourself.
Yes. Madam Bori, can you hear me?
Yes, I can.
Yes. Now, yes, thank you for being with us. As a radio presenter, radio is one of the most powerful elements of communication. You guys break down this data into little palatable chunks that spread even into the villages and the local communities. How has it been for you guys with the event of coronavirus?
Okay, thank you so much, Leon. One and foremost, we have to understand that most of the guys who listen to the guys who live in the off-grid locals, that is in the mashinani, I don't know if it's to be called the villages, you know.
Yes.
Now, these are guys who, for one reason or the other, to listen to the radio. Actually, the person listens to the radio, at the same time your listener is doing something else, you know. So let's first understand the meaning of, understanding what data-driven information is. Yeah, now these are progress in an activity that is compelled by data and not by personal experience. Then now getting to the palatable information. Now, palatable, first of all, is something that is edible, audible, something that is, acceptable. So for a radio presenter, one, you have to understand that you're not being viewed. You know, it's you to make your listener understand exactly the information that you want to relay to them. Now, on matters COVID-19, there's a lot of stuff that really need to get to the listener. And for one reason or the other, the sound intonation part of it, because in radio presentation, actually, there are no pictures, there are no images where the listener can actually figure out exactly what the presenter is talking about. So the way you speak, the intonation that you use actually sends the exact thing that you want the listener to get from the information that you are relaying. Another thing, we talk about the music. Now, the music part of it, we have the jungle also, and yeah, stuff like that. Now, the music actually, you should be so much selective with the music that you are bringing on board. It should be a music that is bringing out the mood of exactly what you really want, that is preparing your listener on what exactly you want to relay. Like for instance, you can't play love music when you are reporting on the pandemic data. You know, it has to be something that is so touchy, something that is, bringing out the mood. Yeah.
Oh,
And
now, just while you are talking about what radio is communicating, is Mr. Hassel still with us?
Yeah, I'm here.
Yes, Mr. Hassel. This is where now we need to understand effectively well as journalists. How do we navigate, especially this, because it goes a long way and merges with what the doctors have been saying all along, that the people are not understanding, they're not being cooperative, they're not understanding. So is it the same in Germany?
Well, I would say that until now, most people followed the guidance or the rules or the orders that were given by the government to take social distancing, to stay at home if it was possible. Shops are closed, etc., etc. But it's, I mean, it was cushioned for many people by some kind of financial aid for the loss they have right now. And it will be also cushioned for the companies, big companies with a lot of money, that's for sure. Yeah, people listened until now, but here in Berlin, for example, you feel a certain defiance right now. After more than 3 weeks of distancing and quarantining and stuff like this, people go outside again a lot, enjoy the sun. They are more distant than before. They try to, yeah, some have these mouth protections. But it's a weird feeling. Yeah, it's now here. The summer is coming, and people want to go outside. So I have the feeling that this liberal stance here in Germany is somehow working. That most people take it responsibly, but they get a bit tired of it. So I don't know how long this is going to take until people start being really angry about certain measures. Yeah, and here, as I said, for many, it's still somehow doable, also financially, but others in Germany, they have big trouble now, big problems. So the anger rises and the questions rises. And that's why I would say journalists have to go one step further and really look at all the consequences that this period might have for people. Yeah? It's important that all those necessities, all those troubles are taken seriously by journalists as well. As was said, what does it mean for children who have to stay at home? Violence at home should be taken very seriously. And now we have to talk about all those measures to help people in need now. And this is not a German problem alone, it's a worldwide problem, it's a global problem. And I think we also have to talk very soon about global solidarity, because there will be countries that will be hit much more economically and socially in the end than some others who have enough financial background to weather a storm like that. We'll be talking in some time about a global solidarity fund, for example, that supports countries that really need financial support. I mean, I hope we see some kind of global solidarity coming out of that, and not more nationalism and more egoism and more everyone is fighting for themselves.
Thank you very much. Mr. Ferdinand, there's a very interesting question for you. Have you seen it? Okay. Mr. Ferdinand, is he still around? Okay, as we wait for him, Dr. Bosire.
Ferdinand is still here. You just need to switch on his mic.
Okay. Dr. Stella, as Ferdinand is still warming up. Dr. Yep. Stella, yeah?
Hi.
Yes. Dr. Stella, now, what has been said with regards to what we should do, what we are not doing? What do you medics predict for us, especially for Kenya, with what you've observed in the quarantine areas, with what our progress is as to where we are until now? What should we hope for?
Okay, you've used two words that I feel contradict each other: hope and predict. We predict that based on the number of cases that we have so far, at least in the next few weeks, we expect the numbers to still keep on rising, especially as we increase our testing. And but if we adhere to the measures that we've been asked to adhere to, the social distancing, the using the face mask, and observing hand hygiene and cough etiquette, we will probably be within numbers that we can manage. We hope that more people are going to buy into the message of protecting each other, not just protecting yourself. You're not wearing a mask to protect yourself. Mostly you're wearing a mask to protect other people from what you may be carrying. So we hope that we will keep up the spirit of togetherness on this one, that we will protect each other, that we will help the vulnerable in society, that we will keep looking out for each other. There's also a concern that has been raised about health services for people with chronic conditions like HIV and the other chronic conditions like diabetes and high blood pressure. And these services are still going on, albeit on a reduced scale. So people should still continue keeping up with their medication, keeping up with their monitoring. Those who need to go to take their children for immunization should not hesitate to do so. Only because services are being scaled backwards towards the bigger hospitals, it's best to call in advance and confirm that there will be someone to see you when you get there. That's a message that we feel is being left out of a lot of things that are being said. So going forward, I feel it's still too early to say that we have done well or are doing well. I think we still need to look out for the next few weeks as we increase our testing. And we expect the numbers will rise, but hopefully within manageable limits.
So, okay. Dr. Wait. It's never a crime to speculate. So I love time frames. I'm sure you do love time frames also. What kind of time frames are we looking at? When are we looking at curfews ending and things like that? And us just now being able to return back to our normal lives, especially in Kenya?
I suspect we'll never really go back to normal life as we knew it. I suspect that some of the habits that we've picked up will stay with us for a long time. I think we'll still see a lot more hand hygiene than we've been having before, and which is a good thing, because again, other diseases are also being prevented, like the diarrheal diseases. So that's a plus sign on our side. We expect that perhaps the lockdowns will be more clustered within the areas with like, say, if it's in Nairobi, instead of the whole of Nairobi being under lockdown, it may be within a specific estate and not the whole county being under lockdown, where there's found to be a cluster. I don't know how long it will last. I cannot speculate on that one. I don't want to commit to anything. And
Is
I know,
Dr. Busire here?
I think she's left.
Dr. Busire. Okay, now, and don't you, I was just thinking about this the other day. Don't you find it very interesting that with all the technology, all the scientific discoveries in the world, the best protective weapon we have is just basic hygiene? Are we as humans forgotten to be clean that bad?
I think we assumed a lot of things as we developed. We think we forget that the basic principles of public health always are what matter the most. So hygienic practices will always be king in any environment, any condition. Hygienic practices will always be king. I feel like we had stopped having, in our setup, we were moving from a lot of infections to more non-communicable diseases. And coronavirus is taking us back to a higher incidence of infectious diseases. And so we are going back to just the basic practices. However, technological advancement is always good. I feel like within the last few weeks, a lot more people have learned how to use the internet, which is a good thing. We are having medical education sessions on Zoom, just like in this webinar, which is a good thing because previously we've had people in the distant facilities being left out of continuous medical education sessions being held in the big cities and the big hospitals. So our way of life will be a little different, but basic practices, basic hygienic practices will always be king. We should never let go of.
Okay, thank you very much. It was such a pleasure talking to you, especially on such short notice. I know you need to be somewhere, so we really appreciate you. And we hope you'll be coming back again and again to share with us.
I appreciate having been called to join in this session. I've learned a lot from you people and also seeing a different side of things. Thank you so much.
Oh, thank you so much. Ferdinand, Mr. Ferdinand, are you around?
Yes, I'm around.
Yes, sir. There's a very interesting question for you on YouTube. Did you see it? I know you saw it. I just wanted to give you a time as we close, for you to react to it and your closing statement.
Yes, there was a very interesting question on verifying government information which we are given. And I understand the general skepticism with the society when it comes to government information. But the basic practice of journalism, that people know that among the trusted sources, among the sources of authority from which you have to base your information, has to be government. For instance, even if police say that we have shot 6 people in a shootout, the first piece of information, the very first item of news that you put out will be police say they shot 6 people in a shootout. Then maybe afterwards you go and interrogate, was this really a shootout? What happened? You go to the area where that shootout occurred and speak to the eyewitness there, speak to the people who are there. Was it a shootout or was it a killing? So in the context of the coronavirus now, how we verify government information, in as much as they're the first point of information from COVID-19 in terms of the numbers and the mitigation measures, there can be immediate interrogation. For instance, here in Kenya, when there was health minister said that masks were selling for $5, 5 shillings. And today there was an immediate query, you say they're being sold for 5 shillings. Where are they being sold for 5 shillings? And can you prove that they did retailing for that cost? And when it was immediately questioned, he said, well, you know, it used to cost 5 shillings, but now it is 20. But then he could still not explain where the 20 shilling masks are being found. So immediate interrogation is one way to find whether government is just selling you hot air. The second way that we try to verify government information, for instance, could be post-info analysis. And for instance, that's when the government, again, I can give an example, when the government say that Kenya is moving towards having a capacity of 1,000 ICU beds. You cannot verify that immediately. It goes the way it is, and later on you go and speak to experts like Dr. Bosire, will tell you that Kenya has just over 200 usable ICU beds, and not even all of these are available for the people who have COVID-19. So that's how you debunk some of these lies or misinformation, or very cleverly given out information from the government. Other aspects is sometimes trying to get the information from restricted areas. For instance, we cannot really know what is happening in the isolation centers unless the doctors who are there tell us. We cannot know what is happening in China because we cannot even get in there, and even the internet access is restricted. And these where whistleblowers, for instance, come in. When the government was saying that we have stopped flights, somebody shared a video from in there in the Jomo Kenyatta National Airport showing that there was a full passenger flight from China that was coming in. And then we said, well, you say this, but how about this? And later on, you see how it caused a ripple effect. And also when the government says that the people in quarantine are well taken care of, them all the facilities, we will now depend on the people in there to show us exactly what facilities are there, and to measure that up against the accepted general standards or the WHO standards and get a reference on this. And so we need to see, these are some of the methods that journalists use to verify information given. But let the people not forget that you cannot also be overly critical of many journalists who sometimes cannot be able to do all these things. Remember that these restrictions imposed to manage the spread of COVID-19 have also restricted how journalists can access information. There are travel restrictions. So for instance, we cannot travel from this place to another because there are no flights, or there's lockdowns, or even when we are essential services, we also have to consider, is that travel warranted then? And if I cannot access somewhere, for instance, I cannot go to Mombasa and see how the governor there is trying to place all this, to put these measures that are now being pressed all over Kenya, for instance. Whereas I may be protecting myself, I also have to protect the stringers that will be sending there. So some of those standards are set to keep myself safe, are the same ones that I also have to put in terms of putting the risk of those who give us information, as well as those who are willing to travel to record that information on behalf of us. We cannot get to such places. And also remember that unlike other pieces of information, unlike other events, journalists are also looking at personal safety at this point. And for instance, now most journalists, you see, they're working from home, they're reporting from home, they're broadcasting from home, they're doing interviews from home, Skype interviews, and some of the lower qualities sort of video that would never have seen the light of day now have to be used because of social distancing and personal safety. So these are fluid sort of situation that has been brought about by this pandemic that also the journalist society or the world of journalism is learning to adjust to and find new ways of verifying information without personally being on the ground as we would have wanted to.
Thank you so much, sir. And what is your parting shot?
My parting shot is this. To the world at large, it is important to keep safe. And if you cannot, stay at home. And it is important to stay at home and follow the guidelines. To fellow journalists who are on the front line as well, please remember that you also are susceptible. You can contract the virus, so hold yourself safe. And in terms of the practice to journalists, remember that there's so much going on. Let us not be part of the problem. I've seen some websites normally going to share what is fake news that looks very legit. So before you share information, before you put out information, try and put it through thorough investigation by looking at the source, looking at the websites, look at who shared it and why they would want to share it, so that we as journalists can become trusted sources for sharing this information, that because all of us right now are working towards flattening the curve. And also try and learn these words and what they mean, so that when we put out information to the public, they can understand what exactly we are saying them, and not just passing on corporate or government or health rhetoric, which the audience may not eventually understand and help themselves with.
Mr. Ndubi? Mr. Ndubi, are you with us? Eric?
I think I had switched on my microphone. So thank you, Leon. I wanted to add a little twist to this. I found a lot of reporting on people looking for good news. It's such a grim situation around the world, and there's a lot of demand for good news about corona. Oh, in my country, probably that was what Magufuli was thinking when he really never really did anything to control the spread of virus. But I am finding that the fact that, and I started this conversation by saying that the audiences, as how much we have mapped them, and we really concentrate on the Kenyan audience, and we don't really have a lot of, in my work, we don't have a lot of global audiences unless they are Kenyans, is there's a lot of people looking for good news. And that has translated into journalists having the urge to give good news. And that has also gone to the fact that are you trying to give good news, or we have more recoveries? I remember when CS Cargo tried to was giving, and probably coincidentally gave more numbers for recoveries, and there was like, we should prime the recoveries, and more people are recovering. And then when we prime more recoveries, when in with a backdrop of how many are we testing, and really can we even compare the confirmed cases with recoveries? We are probably giving false hope, and the journalist is in this dilemma of really not wanting to alarm the public, and also not to give the public false hope. I feel that is one of the challenges that journalists are facing at this point, in terms of not being very doomsayers, but also not giving false hope. This question of flattening the curve, are we really, especially in East Africa, really in a position to talk about flattening the curve? What curve do we even have? Tanzania the other day would have said, hey, there was even a video of a pastor saying, oh, please look at these other neighboring countries. They have been doing lockdowns and stuff like that. And Uganda has been very decisive about how they want to handle their coronavirus situation. And I spoke to a friend, and these lockdowns, and there's a question of how our African, and I would say East African governments are handling. That's probably the information that I could decisively talk about. How are we handling, and the question of lockdown, and that is informed by several incidences, including one where somebody who was diabetic, and there was a lockdown in their country, Uganda, and they were not able to access. Diabetic people have some set of foods that are given by their governments, or they need access to, and they were not able to do that. And also the lockdown required anyone who needs to move, they have to get a permit to move. And then they had to take like 6 hours to get that. And the person died once the permit was given, and the permit was given 6 hours later, and that person died the very moment they were at the hospital, after they were transported to the hospital. And how our responses to this pandemic as African countries, and we cannot, and I'm looking a lot of how our local coverage has been, and our local coverage unfortunately has been fed by what we could give Italy, Spain and Wuhan as examples of how responses work, but they don't work to us because it's not contextual. So I feel like our coverage locally has been about, oh, what can we learn from Italy, Wuhan, and Spain, and probably now very decisively the US, and we try to transport that to Africa, and it doesn't work. I'm gonna add one more thing on challenges, especially specifically to our Kenyan situation. And we have had serious queries raised about the data presented by the government. The other day, yes, and there was a report by the Daily Nation today about how we cannot really trust the government. And Ferdinand has talked about how we, at this point, we have no option but use the government data as a starting point in how we do it. But serious queries have been raised by how the government has been giving erratic information. I have had to call the Minister of Health severally, probably every 2 or 3 days, when they give information and it doesn't, it has to be corrected, and they have had to correct what they tell us, who has been tested, who died, and how many positives they have had. And it's very funny how they cannot really even tell us who the basic numbers of who is positive and who has recovered. The other day, this is according to the Daily Nation report, private hospitals have been recording deaths as pneumonia. And we even had, and if you can go online and check, there are stories of a strange, that's probably the star, mysterious, that's probably the standard, illness killing children in Kilifi and thereabout. And there's a lot of speculation that's probably also COVID-19. The government has not even pronounced themselves on that. And journalists are getting into this space where they are trying to do self-censorship. And if you remember, self-censorship has been one of the things that saw the Spanish flu spread. They don't want to they don't want to annoy the government. And we have seen this even the other day when the Citizen TV was very decisive about.
Just to interject you a bit, not only annoying the government, but some, in my view, also protecting corporate interests. They don't want.
Exactly.
So it's the time we have to decide as journalists, are we going corporate? Do we want to please, some journalists have doubled up as influencers. So they've forgotten the sacred role of journalism. And that is a problem we need to discuss very soon.
Yeah, and we should want to talk about that self-censorship and the fact that journalists can't really tell the truth, because I mean, we are in a media environment where we depend on advertisement. And if, for example, any of the corporates and which we really pay our bills are not responding in effectively to this situation that is facing the very customers that they serve and depend on, and they are the people who pay our salaries, we choose to not really expose them. But I would even not really go to the to the corporates who pay our bills, but also how the government has been handling this. There's been serious queries. We've heard of all those. I don't know. I hope you guys have seen our private. We probably saw that story of strange and mysterious illness. There's a lot of pneumonia deaths that are being reported, and my hunch is these deaths are very closely related to COVID-19. But again, that is misinformation. You'll never find that information being published as such. But the thing is, remember the Spanish flu and how publishers in the US were unable and they were compelled to not speak to the gravity of the situation. And I'm not saying the situation is as bad in East Africa, but people need to have some sort of certainty. The other thing that I would point out in terms of our challenges, in terms of giving our audiences the truth, is there's a certain level of failure in centralized communication. We have the Mandela governor confirming some cases. We have the CIA governor confirming something. It's very inconsistent. There are errors in the MOH communication. And there's Ministry of Health. And there's the cabinet secretary becoming a preacher. I think there have been opinion pieces done about our CS who the country has really fallen in love with, but wondering why is this cabinet secretary becoming a motivational speaker when he also is overseeing erratic communication. And journalists are specifically in the online space wondering how exactly do we communicate this information without being complacent or without being alarmist. And I'd want Ferdinand to add something to this, because we and my publication really works for Kenyans, and we cover whatever is happening in Kenya. We have seen a lot of arrogance, and Leon, you've covered this a lot, that we have administrators being absolutely insensitive in the way they communicate as if this is normal times. And as journalists, and this is really goes to the theme, and this is what I want to address in my remarks, that there's a lot of self-censorship in terms of I don't want to be alarmist, I don't want to be complacent, but I'm stuck in the middle. So, and I see a lot of this if we just resort to reportage. Please, Ferdinand, I want you to add something to this.
Yes, we are in very unfortunate times, especially here in Eastern Africa, or you can say Africa at large, and closer home in Kenya. You remember when Citizen TV sort of, one would say objectively, looked at how they covered the Tanzania president or the Tanzania government's hesitance to enforce the lockdowns that the neighbors are enforcing. And it's a word used to kaidi some sort of rebellion that the government was unhappy with. What surprised me is that they've been putting forward an apology, a recorded apology every single day for a week. That is not an apology, that is groveling, because they want to get their coverage in Tanzania back because they've been switched off. There's two ways to look about it. First of all, this is a huge affront on independent journalism from a government which has now been criticized even by the ICJ. And you look at so many human rights organizations have been questioning freedom of the press, especially in Tanzania. And you find Citizen TV itself, royal media services, at a sort of catch-22 situation where they are now wondering, how do we maintain our independent journalism at the same time also appearing to apologize? A lot of people will look at this and say, this is how far governments are proving that they can be able to twist independent journalists. I think 1 week was overstretching it by any stretch of the imagination. And there's going to be a lot of debate is going forward. And then you also look at Kenyan media houses where they also depend on advertisements. And I've been here long enough to know there's a time when there was a company which withdrew its sponsorship, and it was about 3 million Kenya shillings after a story I had done. And this was a public institution, and the marketers really went crazy with me. But when they looked at my story, it was objective because somebody in that institution had lied. And then you also see that a lot of these media houses are now co-owned or owned by politicians, and these politicians have interests, and sometimes you get the sense that some journalists are serving the interests of these politicians and not independent. Unfortunately, what you do not see is that the public can see through these half-baked or biased stories, and I like speaking my mind. Because I have this privilege of being able to speak independently without a fear of losing my job or being censored, as long as I am speaking facts, and you can tell that there are even editors and the media houses that are biased towards something as long as it brings in money or it brings in goodwill. And we have seen people fired for writing stories that criticize some politicians, that criticize the government, or some stories killed because a huge telco or corporate will withdraw thousands of dollars. So it is a question, it's a balance between survival of media houses and keeping independent journalism alive. And I can tell you for sure that it is independent journalism that is losing that battle. And this is a discussion that will have to be taken forward. And that's why you see a lot of Kenyans say they prefer Twitter, because Twitter right now is where people speak unhinged. There may be a lot of sensationalism and a lot of misinformation, but sometimes it is social media that breaks out some of these stories that previously would never have seen the light of day. And I think it is time for journalism or media houses to find sort of alternative ways with which they can try and survive without saying always be willing to sacrifice
now, Mr.
at the expense of getting money. That's what
if I may interject for a minute, you've mentioned Twitter and I lit up. This is the reason. I have observed that many journalists also are spending so much time on Twitter, fighting Twitter wars and all those things. They don't do stories. What time do we work when we are spending? Yes, we have to monitor the public. And also, Mr. Ndubi,
yes,
do you have a social media policy for monitoring how these data stories are going to get done? and how these other objective stories are get done during COVID with regards to Twitter, because there are many journalists who are always all over Twitter doing this, doing that. What time do we have to go to the field to go and fact check when you're spending on Twitter the whole day?
Before Ndubi answers, let me just throw in something which can also comment out as a response. And this is something that Leon you mentioned, and this is going to rub a lot of people the wrong way. But you also found out that the journalists right now who are doubling as influencers and people push brands openly online. And if I'm going to push a lotion and show this lotion is best for you, or this beer is good for you, when it then turns out that this lotion brings skin disease, or that beer has been pouring influence into some report on this negativity while I am part of that brand. And recently you realize that some media houses that have been pushing brands in a way and involving newsroom journalists in pushing certain brands, and these brands then turn out to be scams. And now they're in this awkward situation where they're telling people, these people have been arrested for selling a scam, while the media house itself was part of that scam.
Yeah.
Ndubi, as the editor, can expound on how this can be resolved.
Right. I think this boils into the larger question of journalistic labor, and the journalistic labor in our economy is very unappreciated. And journalists are found, and we are excluding the business side of the businesses that are employers. And we very well know, I work for a very online media outlet, and we depend on how we can attract revenue in very many ways. I'm looking at broadcasting, and the very Kenyan media is all about advertisement or nothing. So you, as Leon, if you would work for one of our local broadcasters or one of our local publishers, you would be compelled to never hurt the whatever that feeds you, isn't it? And so you still want to tell a story, but you want to tell a story and not have hurt your revenue. And without the revenue, the public, and this is a very, very complex discussion, that without the revenue, no one is going to pay for. We don't have a very weak public broadcaster. If we had a very strong public broadcaster, then we would never be in this situation. But we have the weakest public broadcaster probably in the region, and I probably have even more stronger one. But the thing is, our private broadcasters, our private publishers, are what drives what we'd call, under constitution, is called one of the most freest in terms of media freedoms. And as such, the commercial angle has always have to be explored before a story goes out. When you go across the board, yeah? And as such, journalists have to be in this situation where they have to think critically that they want to maintain their credibility with their audiences and still earn their pay, and not just earn their pay, maintain the organization for which they have been given the opportunity to tell stories. So we cannot always tell stories as how Ferdinand's BBC would tell it, because BBC has the backing of the British public. We do not have anything that resembles that in Africa. No one can claim, even the newcomers who promise independence in the online space, they still depend on advertising revenue. And that also, in a large extent, especially for broadcasters, governments are, and the Kenyan government and Uhuru Kenyatta has been very decisive in understanding how to stifle the media by just taking away government advertising from the media. So how do you still attract? You have to be very close to the government. And that's what I'm saying, that we have to operate in this environment that we do not have a way of manipulating, make the money and still pursue the cause. And that's why you see people resorting to social media, which in a sense, and you'll see people, if they post really, really offending in this sense to the business end of journalism for the companies, then they would lose their jobs. That's why you see people treading a very narrow path on social media to tell their audiences and people and journalists have a following that, hey, I am not lying, I am not losing the cause, but they still have a lot of filters. And that's why you might see the cargo figures, the quarantine stuff, not really making it in the media. There's a lot of whitewashing, but it's because of the technicalities of this business.
Thank you very much. Thank you very much. Now let's just close up because I can see we are so in and out of time. Madam Joy, a closing part from you, just 1 minute or so. Is Madam Joy around?
Yeah, she is.
Leon, listening to Ferdinand and Eric, I really like the challenge that comes with the new media, the one they post. And I like the fact that Ferdinand can speak his mind out. That is very commendable. It's unfortunate. Okay, I've practiced with an international media and I understand, I've done both local and international media, and I understand the comfort that Ferdinand is coming out from. Is being backed with, like he can write and have either his media house support him. But I've been the Secretary General of KCA, Kenya Correspondents Association, for the last 2 years. And I can tell you for free, I know so many journalists who have been sacked because they wrote something that went against the media house. This is a challenge that is coming out even with the COVID cases, where journalists are finding themselves torn in between. I know for a fact that I had news when we had a case of a South African woman committing suicide. I had very, very different information from what the government was giving at a quarantine center in Nakuru. And I had very different information. So I think both as journalists and as new media, we're being challenged to, we are at a point where Kenyans are torn in between, do we trust the government or do we trust the media? And I respect the fact that we still have journalists who can stand out and say that this is what's happening. But I am also worried because I've seen a crop of journalists who do not want to displease the government. Mainly most journalists who were either fished out from mainstream journalism and they went to the county governments. I would point names, but then they will come for my neck.
Okay.
But I like the fact that we have journalists like you, Ferdinand. Back to where I stand on children, I feel like children are victims of circumstances. I feel like there's a very big gap where we are not giving our children any noise. If they get out of the house, they're going to be arrested. There are no statistics. I don't think the government has even come up with a plan of how to even handle the children. Even the way schools were closed, it was so sudden. They were given 3 days to leave school. And we have issues of both domestic violence on the rise, rape on the rise, other crimes on the rise. So I feel like even as journalists, we need to prioritize more on how are we communicating COVID to the children. And it's a challenge. We don't know how long we'll be stuck with this. We don't know how long it will take to find a cure, but I feel like we need to do more, in particular to getting kids.
Thank you very much. Yeah, thank you very much. Now, Mr. Ndubi and Mr. Ferdinand, this is was something I need to share with you specifically about the other wing, that is COVID-19 reporting data, with regards to now, for those of us who are having a taste of the reporting while we are so far away from home. Now, the biggest challenge, as I have noticed, is that we have embassies that do not want to support journalists. They do not want to share information. I try telling, for example, the Kenyan High Commission that, you not sharing and sitting on information is actually making causing a gap with regards to information. Now, what do you think should be the way forward? Because you're so far away from home, Kenyans are dying, some are sleeping on the streets in Delhi. The media is not giving it the weight it should deserve because they are looking for, because maybe perhaps Jubilee is fighting, I don't know, they're having an internal wrangle or something. So how are we setting our priorities, especially Mr. Ndubi, as an editor?
Mm-hmm.
How are we setting our priorities right now? Because I'm seeing us highlighting Jubilee wars internally when Kenyans are sleeping on the street. Some of them are even, there are Kenyan patients who are abroad and they're in India on the streets in Delhi and they're actually taking strong tea for dinner, a meal, and the government has refused to bring them home. Are we helping provide solution?
I think as Kenyans.co.uk, we have really tried to expand the menu of the stories that we give readers. And we have not been silent. And this in respect of what government has on what the media in Kenya can do. And I'm saying can do because we have seen government strong arming our very established media outlets from doing even from broadcasting even some of the very domestic issues that are well known to the public, and social media has been the avenue within which that the government cannot really point out the media as the only place that they are being bashed. So when we talk about how I'm sorry, I think I've lost one of the questions that you asked me. I was addressing the issue of war of India and
yes.
Yeah, this has been played out very much in the public in terms of how much the government has been forced to respond to its treatment of Kenyans abroad and give a very, what I would say, a very arrogant response to the plight of Kenyans abroad. I want you to repeat one of the other questions that I wanted to respond to. I don't remember exactly what you asked.
It was basing on our priorities, getting our priorities right.
Yes.
Yes,
Get
Jubilee is fighting, Kenyans are dying on the other side.
Yeah,
but we leave Kenyans who are dying, we rush to Jubilee that is fighting internally.
I think what I could speak for the online space, and the online space has a lot of advantages away from the broadcast space, that we can tell what the audiences are looking for. And I started this conversation with saying that the focus that should be done for all our content that is published is what is the audience seeking. And the audience is seeking a lot of corona, and the audience is also seeking something that will take them away from the grief and the shock that is corona. And that's why I would defend the focus also on party politics in terms of the audience seeking that. And if you understand the audience as a broadcaster, and this is unfortunately, but it's not very unfortunate, because we will eventually defeat this corona, or this corona will just give up on us at some point.
Which explain why we found a way today to sneak Deputy President back into the front page. I saw somewhere.
Exactly.
Yeah.
So publishers are asking themselves, and remember, and I would want us all in this panel that we are left today to realize that the media is a business, unfortunately. And if there's no revenue coming to the media, there is no information that is going to the public. That is the hard truth that the media cannot make it. And Fadi will not really resonate with this as well, because we wished that we will have something.
This is what we will do. You, Fadi, and I, and another panel will be back for that conversation very soon, because that is another conversation. But for now, we are running. We have really run out of time. We have even overstretched. I wish to request Madam Hope Mbori in just half a minute, give your parting shot, and then we close. And then Madam Jennifer to take over, and then we wind up.
She's left. She's left.
Okay, okay. Okay, Madam Jennifer, go ahead.
Me, I want to say thank you so much for joining us. This is 3 hours of great discussion. We've discussed on data, on how, as journalists, we need to consider some unreported stories, and how we do a holistic form of journalism and reporting, and not only focus on one area, and to be able to verify. I like what Fadi said about verifying our information and looking at the context, because most of them we are given numbers, we don't give the context of the numbers. So for me, I'm very happy, and thank you guys for joining us and participating in this conversation. Thank you very much.
Thank you so much. So guys, it's been real. For our audience, thank you for the insights, for the social media interactions. For my seniors who spare time to grace this webinar today, I thank you immensely. I've taken a lot of notes, and we live by learning. So until next Saturday, keep safe, and God bless you all.
Thank you very much, Leon.
Thank you, sir.